As far as education and training are concerned for chiropractors, there is a prerequisite of at least 90 credit hours in an undergraduate program. And then the chiropractic degree itself is a 3.5-year program where you study anatomy, physiology, microbiology, biochemistry, and then obviously the techniques that the specific school teaches us in adjusting the spine. X-ray and MRI films are studied. Chiropractors take 4 sets of national boards at the end of their program, and different states have different licensing requirements, which may also require a little further education. If your insurance doesn't cover chiropractic, you should definitely undergo chiropractic care anyway. Life involves a lot of things that we have to pay for out of pocket, including eating well, drinking enough water, drinking filtered water, going to the gym. All of these things we pay for because we know that they're important for our health. And chiropractic is in the same category. Maintaining spinal alignment and your nervous integrity is important whether or not your insurance pays for it. Pregnant women most definitely should be undergoing chiropractic care, and there's 2 reasons that I like to explain for that. First of all, we want to make sure that your pregnancy proceeds as flawlessly as possible. We want to make sure that your brain and your uterus are communicating as effectively as they ever have in your entire life, so that your brain can orchestrate this pregnancy appropriately. In addition, when you're pregnant, you obviously don't want to be taking a lot of painkillers and drugs that might interfere with the development of your growing baby. So chiropractic is an excellent form of pain relief, whether that be related to sciatic pain or just the general aches and pains that happen as your body changes shape. And as you're getting closer to delivering, we want to make sure that we get you in at least weekly so that we can get your pelvic opening to be as round as it possibly can be. So here we have my model of the spine. Here's the pelvic opening where the baby will pass during labor. And you can imagine, even if the pelvis is tipped just a little bit, how a little shoulder or a hip could get caught up on one of these surfaces and make the delivery more difficult. So we want to make sure that everything goes as smoothly as possible when you're delivering that little beautiful being, and that's why you should be getting adjusted. People often ask me why children would need chiropractic care. And the very first thing I think when people say that is that being born alone is a traumatic process. When the process of labor starts, the bones of our skull actually fold over each other so that the skull gets smaller to pass through the birth canal. And there's potential that maybe those bones don't sit in a perfectly neutral way when they come back out. Also, if you think about how crowded it is inside the womb, little tiny fetuses are often in awkward positions for several weeks or even up to a couple of months and are unable to get out of those positions. And if you imagine someone having their head slightly tilted as they came through the birth canal, that could set up a pattern that gets established in their neck and upper spine. So obviously I think newborns should get adjusted. But then you think about just the process of starting to crawl, and almost all of us have known little children that have fallen off the bed, or when we're learning to walk, think about how much we fall. So those traumas affect children also, not as in the same way that they would affect an adult, but that can create a situation where the vertebrae aren't quite lined up as efficiently as they could be. So we like to get children in regularly to align their spines and make sure that their nervous system is firing 100% with their brains and keeping them as healthy as possible. People often ask if they will have to remove their clothing in order to receive a chiropractic adjustment. In chiropractic school, we were encouraged to address people's spines skin on skin. So we would put people in gowns and we would palpate their spines with no top, and they would leave their pants on. However, here at Swan Lake Chiropractic, we find that with the years of experience we've had, we no longer require that one-on-one contact with the skin. So here at Swan Lake, we do not require people to take off their shirts. But that will vary from office to office depending on where you're seeking your chiropractic care. I'm being asked to address whether a chiropractic adjustment is similar to a massage. And actually, they are completely different modalities of health and well-being. The chiropractic adjustment is a very precise application of force to shift a vertebra into a more neutral position. Massage is an attempt to relax overly taut muscles. Now, these two modalities often work very well together, and there are chiropractors who also incorporate massage into their practice. Obviously, if your muscles are more relaxed, it's easier to move the vertebra, but they too are completely different processes. People often wonder how they will know if they need to seek out chiropractic care. And if you have a spine, you probably should be making sure that it's lined up, because it's made up of 24 individual bones that have the potential for independent movement. But there are some other red flags that you can notice with your own body. First of all would be pain. If you have a restriction in your back or in your neck, that obviously can be a sign that your body is telling you something's not quite right. But some of the other factors are decrease in a range of motion or a decrease of function. So decrease of function can mean that you're having tingling in another part of the body. It can mean that you're experiencing sudden changes in another organ system, such as not digesting your food as well, or feeling like you can't inhale a full deep breath. Each of those things can be a symptom that your nervous system is not communicating effectively with your brain. I've been asked to explain what sciatica is, and sciatica is a description of pain that people experience going down one or both legs. The sciatic nerve is actually the largest nerve in the human body, and it takes its branches from L4, L5, and the sacrum, and portions of these bundles form a single nerve that's about the size of the human thumb. It passes through the pelvis and comes out of the pelvis and goes down into the leg at what we call the sciatic notch in the pelvis. And this nerve travels straight down the back of the leg and then branches out and goes all the way to the foot. So if someone is experiencing pain going down their leg that doesn't go all the way down into the foot, or perhaps wraps around to the front of the leg, that's probably not sciatic pain. But if they're feeling it past their knee or into their foot, there's a good chance they are experiencing sciatica. How do you choose a chiropractic clinic? And that's a pretty difficult question, because people go to the chiropractor for different reasons, and there's a lot of different types of chiropractors out there who practice a lot of different chiropractic techniques. So I think it's important for the patient to think about what they are trying to achieve with their chiropractic care. If you're just looking for short-term relief for a temporary problem, then you might do well just going to one of the corner $25 clinics that are popping up all over the country. If you have a more longer-term situation and something that has not achieved success through other modalities, you're going to look for a clinic that offers more personalized care and is willing to consider your situation as unique from everybody else's. So what happens if chiropractic care doesn't work? Obviously, because there are so many different types of chiropractic techniques, they're not all going to be a good fit for every single person. So a good chiropractor is going to have more than one tool in his or her bag to try a new technique. I personally will give my standard technique 5 or 6 tries to see if it is effective, and if not, then I go into my tool bag and pick out something else to try. I also will then send patients to the other practitioners in my clinic, because I know that their techniques are slightly different than mine. We are truly blessed because in general people do get better, and so it's rare that we have to think about sending people out, but we also have a database here at Swan Lake Chiropractic that helps us establish what the next step should be if someone doesn't respond to our care, and that includes referrals to other practitioners, surgeons, PTs, massage therapists, acupuncturists. The list is hundreds of people long, and we can individually decide where we need to send a patient next if they're not truly getting better.
Chiropractic is great, and so are you.